Hello, this is Dr. Stanley Lang. Welcome to this broadcast, which is on the many faces of Lyme disease. The reason that I wanted to share these thoughts with you today was that I saw 3 different patients with 3 different presentations for Lyme disease today. One is a patient that presented with something that I'm seeing increasingly, which is a variation of central nervous system Lyme disease, which is vertigo. This patient had severe vertigo, but in this case was also associated with hearing loss. And because he already had poor hearing and was wearing hearing aids, it became a sort of a catastrophic event for him. And during the process of his evaluation, he thought, and one of the other doctors thought he had Meniere's disease, but he wasn't getting better. He was getting worse in both his vertigo and his hearing loss. And so we did initiate treatment for Lyme disease with antibiotic therapy. And within a week, his symptoms started to improve. And now, more than 2 months later, he is still steadily improving. Now, one of the big features that I have gone over with this patient, which we spent most of the time today focusing on, was actually what you need to do to support the body when you're treating with chronic antibiotic therapy, and that is that you need advanced probiotic support, which I recommend being food-based. So there's a variety of cultured foods or foods that are currently fermenting that I recommend that patients consume, especially when they're on chronic antibiotics. I also recommend the same strategy for the natural program that we've developed. Now, the second patient is somebody that is a probable Lyme disease patient, because we just initiated treatment today. And this person has a combination of pains that she was attributing to her back. Now, this is pretty common because a lot of people have multiple issues going on, and it's easy to blame the symptoms on other things. But one of the features of chronic Lyme disease is that it often doesn't fit the anatomy. So what should be happening anatomically, depending on what the issue is that the patient is having, it just doesn't fit. It's not, there's something that's not quite right. And that's one of the things that alerts me to the possibility of Lyme disease. And that's why I think that's what's going on in this particular patient, who has also some neurological symptoms in addition to the pain that she's having. So my recommendation was a trial of antibiotic therapy. And if she is successful in responding, then I recommend moving over to the natural Lyme disease program that we've developed, because that avoids the long-term downside of antibiotic therapy, which is harming your gut biome. And we want the gut to be as healthy as possible so that the immune system can stay engaged in fighting the Lyme organism, or get engaged if it hasn't started to get engaged yet. The third patient is somebody that completed Lyme disease treatment more than a year ago. And this is a person who has remained very symptom-free. He's feeling really well. He presented with just purely musculoskeletal disease. And this is the most common version of Lyme disease that we see, but there are a lot of other variations. Lyme disease can affect the heart. Lyme disease can affect both neurological and musculoskeletal at the same time. And in this case, it was just a musculoskeletal problem. And he elected to do what I recommend, which is 3 months of treatment for peripheral disease. And over a year later, he remains symptom-free. That doesn't mean that he is free of the organism, because most of the time, the Lyme disease organism is not eliminated by the treatment, because it can exist in a form that we call biofilm. But he's doing very well at this time, and so there's no reason to take more aggressive action, unless he wanted to take a more preventive strategy, which would be then to use the natural program that we've developed, which I have several patients doing that, and it does work most of the time, not all the time, to prevent Lyme disease from sort of coming back, so to speak. And also, as I said, it's an alternative to antibiotic therapy. Most of the time, seems to work pretty well. So if you're interested in that natural program, there's a link below this video. If you're not interested, that's perfectly fine too. The main take-home point from this video is that Lyme disease presents in lots of different strange ways, And one of the things that is a characteristic, as I said, is when things don't quite fit. And it doesn't fit the diagnosis that has been labeled, that the symptoms have been labeled with, very well. And much of the time when that's the case, it actually turns out to be Lyme disease. Now, if you get better, that becomes a non-issue. But for people that aren't getting better, that's a clue. It could be Lyme disease. So I hope you find this helpful. God bless and have a great day.